Coronavirus in children wasn't something we were overly concerned about in the beginning, and children tend to have mild symptoms or none at all. Today, Governor Andy Beshear announced 8 more children under the age of 5 have tested positive for COVID-19 in Kentucky. 2 of the children were 3 months old. As LEX 18's Michael Burke reports, there are simple reasons for the uptick in positive cases among kids. That's the LEX 18 big story at 5:30.
Remember that whole quarantine and school shutdown thing we did with the kids back in the spring? Well, apparently it worked.
Kids were really well protected when we did the quarantining back at the beginning and the isolation, and so we just didn't see it.
And it's also tough to see what you don't look for.
We are definitely testing more, and obviously when you test more, if there are cases out there, you're going to find more.
Dr. Hood says more COVID-19 positive results are coming from babies and toddlers who've been sent back to daycare, and more in young children who may be back on the ball fields or assembling in larger groups. Dr. Hood has had a handful of positive results at her practice, but it's not all gloom and doom.
Kids just in general are healthy. They are healthy little critters, and so their immune systems are strong. They do fight a lot more than us. That's why they pick up everything.
But there are obvious exceptions, like those with asthma or immune deficiencies. That's what makes going back to school such a scary proposition for Dr. Hood.
Those kids need to be in school too, so how do we protect them? It is making me a little nervous just knowing that the cases are going up, but I also recognize as a pediatrician how very important school is.
For a kid, there's really nothing more important, except, of course, their health.
This is something so extraordinary.
In Lexington, Michael Burke, LEX 18 News.
Dr. Hood says parents should keep encouraging social distancing, hand washing, and mask wearing practices with their kids.